corridor as Richard is wheeled toward the exit. He intercepts the family. While the nurses are occupied, House pulls a syringe from his pocket and secretively injects the cortisol into Richard's shoulder. He walks away without offering an explanation. Minutes later, Richard's fingers twitch. He reaches for the joystick on his wheelchair. He stands up on his own power. For the first time in 8 years, he looks at his wife and son and speaks. A man written off by the entire medical establishment is walking through the lobby. The family collapses in shock while the miracle unfolds in a public hallway. House watches the result of his gamble from the shadows, his diagnosis proven correct by the simple fact of a man standing. Dr. Gregory House returns to the hospital after surgery, walking without his cane for the first time in years. His colleagues, Cuddy and Wilson, immediately launch a coordinated psychological strike. They tell House he made a fatal error in his last case, claiming his arrogance led to a patient's death. House begins to doubt his own memory. The mental strain triggers a psychosomatic reaction. The pain in his leg returns, and he starts to limp again. Cuddy and Wilson meet in private to confirm their plan. They are intentionally lying to House to manufacture humility. They believe his recklessness is a liability, and that gaslighting him is the only way to control his ego. They watch him struggle, justifying the deception as a necessary intervention for his character. While House treats a young boy who believes he was abducted by aliens, he notices an anomaly in the hospital atmosphere. His team is unusually supportive. Wilson is not arguing with his theories. House processes the data and realizes the contradiction. If he were actually failing, his colleagues would be attacking his medical license, not offering him comfort. He deduces the entire conspiracy through pure logic. The realization breaks the psychological hold Cuddy and Wilson had over him. House enters Wilson's office, standing straight. The limp vanishes. He confronts Wilson with the fact that the misdiagnosis was a fabrication. He proves that their attempt to break his spirit only confirmed his intellectual superiority. House reclaims his dominance in the hospital. He is not a man who needs to be humbled. He is a genius who is right. God doesn't. 7-year-old Clancy wakes up screaming about a metal chip in his neck. He tells his parents the aliens are coming back. Most doctors dismiss his claims as a vivid nightmare or a plea for attention. House looks at the boy's rectal bleeding and his absolute conviction. He orders a full genetic workup. The DNA sequencer reveals a biological impossibility. 2 distinct sets of genetic code within a single body. Clancy is a chimera. In the womb, he absorbs his fraternal twin, whose cells now survive as a parasitic guest inside his own organs. The medical crisis shifts to the brain. A PET scan identifies a specific cluster of cells that do not follow Clancy's neural patterns. These foreign cells are triggering the boy's hallucinations. House decides on an invasive solution. During open brain surgery, the team must pinpoint exactly which tissue belongs to the twin. House uses an electric probe to stimulate the boy's neurons while he is awake. He deliberately induces a massive hallucination. Under the probe's current, Clancy begins to see the gray figures and bright lights of his abduction fantasy. His brain activity spikes in the exact location of the parasitic tissue. House ignores the boy's terror and focuses on the monitor. He identifies the non-functioning cells and cuts them out. The alien chip was actually a piece of his unborn brother. With the tissue removed, the hallucinations vanish immediately. Clancy is finally alone in his own head. The mystery is not extraterrestrial. It is a cold, internal cannibalism resolved by a scalpel. Dr. House forces medical legend Ezra Powell onto a treadmill. Powell is 71 years old, and his lungs are filling with fluid. House ignores the gasps for air and watches the EKG monitor. He needs the heart rate to reach 130 to rule out cardiac failure. Powell collapses, begging for the right to die. House refuses. He offers a deal, 24 hours to find the cause, or he will personally assist Powell's suicide. House does not wait for the clock to start. He injects Powell with a heavy dose of morphine, inducing a deep coma. When Powell stops breathing, House hooks him to a ventilator. The machine forces oxygen into the lungs, keeping the body alive solely to serve as a diagnostic subject. The medical team stands back as House bypasses every ethical protocol. He is looking for a specific protein. He uses cold water to trigger a nerve response and monitors the reaction. In the lab, House supplies Congo red stain to a tissue sample. Under the microscope, the cells show a characteristic green birefringence. The diagnosis is amyloidosis. The protein is shutting down Powell's lungs, kidneys, and brain. House returns to the room and disconnects the ventilator to wake the patient. He admits he lied about the specific subtype to justify the final test. The condition is terminal. There is no cure, but the mystery is solved. House stands by the bed, having won his wager. He delivered the truth Powell spent a lifetime seeking at the cost of the man's final day of consciousness. Dr. House uncovers a 1,967 medical journal article detailing unethical experiments. The patient, a renowned physician, once injected newborns with radioactive agents to study urinary reflux without parental consent. House uses this fact to justify his own aggressive tactics. To map the patient's nerve damage without a brain MRI, House splashes ice water on the man's skin. The lack of sensation in the left leg and right arm confirms the disease is targeting the peripheral nerves. When the patient refuses a skin biopsy, Dr. Cameron confronts him with his own past. She recounts the infants he irradiated and the cancers he likely caused. The patient admits he has no regrets, claiming that patient rights only hinder medical research. Cameron adopts this exact philosophy. She ignores the patient's lack of consent and forcibly cuts a tissue sample from his body while he is conscious. In the pathology lab, the team applies a Congo red stain to the biopsy. They examine the slide under a microscope using polarized light. The tissue displays a specific apple-green fluorescence, indicating an abnormal protein buildup. This technical result confirms a diagnosis of amyloidosis. By ignoring ethical boundaries and relying on physical evidence, House's team identifies the cause of the multi-organ failure. 17-year-old Ali enters Dr. House's examination room and begins a calculated attempt at seduction. She ignores hospital boundaries, tracking House into restricted zones and the parking garage. Her behavior mirrors that of a classic stalker, driven by an intense, obsessive fixation on the older doctor. House remains detached, observing her with clinical coldness. In the garage, Ali delivers a dramatic confession of love, attempting to frame their interaction as a forbidden romance. House does not reciprocate. Instead, he monitors her biological signals. He notices a profound lack of inhibition that exceeds normal teenage rebellion. He questions her about her recent history and learns she spent time in Fresno, California. House connects this factual detail to a recent earthquake in the region. The seismic activity disturbed the soil, releasing Coccidioides emittus spores into the atmosphere. Ali inhaled these spores. The fungus migrated through her bloodstream and settled in her brain. House explains the mechanical reality of her condition. The fungal infection has compromised her frontal lobe. Her intense attraction and loss of judgment are not products of her heart, but symptoms of neurological damage. The love she feels is a biological error caused by a brain-eating pathogen. House strips away the romantic subtext, reducing her passion to a medical chart entry. He hands her a treatment plan for the infection and exits. The encounter ends not with a kiss, but with a cold diagnosis. Ali is left standing alone, her grand romantic gesture exposed as nothing more than a side effect of a fungal disease. Dr. House discovers his office carpet has been replaced and demands the original back. He claims the bloodstains on the old fabric make it a part of his identity. When Dean Cuddy refuses to return the stained carpet, House stands in the hospital lobby and shouts Attica repeatedly to incite a public scene. He abandons his workspace and forcibly moves into Dr. Wilson's oncology office. House occupies Wilson's desk, interrupts patient consultations, and plays with office toys while other doctors discuss a critically ill child. He ignores medical protocols to focus entirely on his personal grievance. House informs his team that he sensed weakness in the administration and will not return to his station until every fiber of the old carpet is restored. During a confrontation, he analyzes a patient's stool sample and identifies traces of calcium carbonate. He uses this medical fact to mock Cuddy's management style and her inability to enforce discipline. He tells her that making threats without the resolve to execute them results in a loss of authority. The tension peaks when the young patient suffers a cardiac arrest. House uses the sudden medical emergency to exit the room and end the argument on his own terms. He treats the hospital's administrative rules as minor obstacles. By refusing to work and occupying the territory of other departments, he creates a logistical crisis that the administration cannot ignore. He forces the leadership to choose between standard hospital regulations and his indispensable diagnostic skills. Eventually, the rules bend to accommodate his demands.